All right, welcome to TCT 2019, everyone. And as they say, now it's time for something special. For those of you who know Dr. Zubinamania, aka Zdogg MD, he's rapidly become the voice of the social conscience of American medicine. And for those of you who don't know Zdogg, now you're in for something that's truly going to be unforgettable. Zdogg, come on up.
Yeah.
Man, judging by those two cases, you guys really are morning people. Luckily, so am I. Nah, usually I don't do this, but going ahead on DC and a little previews to readmit. I'm not trying to be rude. Hey, see, Jeff is killing you. Lungs congested up with fluid. Well, my census is 32. That's why I'm all up in your grill, trying to get you to a lazy spill. You must be an HMO, the way you'll not be paying the bill. DC to home. Page, give me that. Bouncing right back to the ER. Crackles, wheezing, edema. Why did I rush to DC? It's my 10th readmission. I'm not the sharpest clinician, but I thought I'd see a patient. What to eat Kentucky Fried Chicken? So caregivers the sun. I'm like, so what? He's one. There's a freaking picking. All you have to do is manage the pump. Bounce, 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 bounce back. Bounce, bounce, bounce back. Now it's like murder road. Once I get you out the door, PCP screaming whoa. Medicare won't pay no more. Girl, I'm feeling that you're healing. I'm just hoping and wishing all of them bloody BMs mean a colitis remission. So give me that through the color of bouncing right back to the ER. Found down in diarrhea, prostate scorus subsera. Got one more admission, going up from the joint commission. My one-day prednisone tapers, probably why our colon's now missing. CC creatinine need one. Now it's 7 point something. It's the freaking tweaking. Who am I gonna get to place a Quinton? Crystal popping on the joint aspiration. Guess I'm this culture scene on his med reconciliation. I got swelling on the left, he's flaccid on the right. The INR is 12, so they'll be paging all night. And after the stroke, there's the aspiration. And after hit chokes, there's the intubation. Roundabout 4, we hit the NASA station. And take it to the room for ventilation. To the unit now. Ventilator goes beep. At least he's off on my floor. Don't need to see him no more till I'm subpoenaed for court. Let's prevent readmissions and into those chronic conditions. Each I'm preparing the handoff, move along to other clinicians. Verbal instructions are clear, only the patient can hear. Take some freaking tweaking, never gonna get up into air. Going up on the squad, reconciling legs, bouncing back and forth to the readmit. We ain't getting paid for. TCT 2019! Oh, snap! Okay, so I'm going to do this in record time, which means we start at the beginning. The Indian Orville Redenbacher. Also, my father. I know nobody believes it. They're like, there's no phenotypic resemblance between the two characters, but I did the 23andMe. He is actually my father. An Indian immigrant physician came to the Central Valley of California with nothing in his pocket and started an outpatient primary care practice. Now, my mother's also from India, a psychiatrist. Explains everything. Also explains why I was always grounded in exactly 72-hour increments as a child, but that's a different subject. 2 Indian immigrant physician parents. Am I going to be an artist when I grow up? No. Those of us who are the children of immigrants know, right? There is no test these people will not criticize. Even a blood test. It's very hard to impress these people. So when my dad asked, what do you want to do when you grow up? I looked at him and I said, I want to be like my hero. And you could see him just swell with pride. And then I said, Weird Al. And you know that thing that Indian guys do? He started doing that, and you never know if it's good or bad. And he said, Weird Al. Being a professional clown won't put naan on the table, okay, buddy? Weird Al. You come to my clinic, you see what I do, and then you will see what you're going to do. So of course I had no choice. I went to his clinic and this is what I saw. I saw Health 1.0. That glorious cottage industry of a doctor and a patient in a sacred human relationship. It was about touch, it was about intuition, it was about the physical exam. It wasn't about ordering a million tests and doing a bunch of stuff. And I fell in love with this. And the thing is, my dad had a thick accent, a funny last name. And so the only patients who would see him in his private practice were the patients with the accents and the funny last names, our migrant farm worker population. And he took Medicaid, which no one was doing, and he took care of these patients, and they were loyal to him. And I knew this because every winter we would get these homemade Mexican treats. And after the diarrhea resolved, I realized they were made with love, you know, for this man who was loyal to them and they were loyal to him. So I told him, I said, that's the dopest thing I've ever seen. I want to do what you do when I grow up. And he looked back at me and he said, you're the dopest thing I've ever seen. What I do is dying away. Now these people want me to see 30, 40 patients a day and click, 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 click on the mice. And I told them, I said, putting mice in the clinic, OSHA, very upset. But they don't listen. So what I'm telling you is you see what I do and you know what you're going to do, because I'm telling you, they don't pay you to do things for people. They pay you to do things to people. Especially to the rectum. There are 5,000 rupees in everybody's colon. Take a scope and fish it out. Do GI, do a fellowship. You know your uncle, Rashid. That's right, first name Rashid, last name also Rashid. Explains why he always got 2 cavity searches at the TSA. It's one for each. Rashid. He is a GI doc. All day his patients are unconscious in the prone position and he is playing video games inside their buttocks. Look what he's driving. Lexus. All day I spend holding the hand, filling out the disability placard, click, 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 calling these idiots to do the prior auth. What am I driving? Look outside, Camry. Fabric interior. I told him, Dad, a Camry is really the same thing as a Lexus. They're built on the same chassis. It's a much more sensible, shut up and don't talk back. And that was literally the voice of Health 1.0, the glory days of medicine to the son. But it would turn out when the son went to medical school, when he graduated, he was met with something totally different. Health 2.0. Health 2.0, where you can barely see the clinician in all this digital noise, was the response to the failures of 1.0. Overtreatment, fee-for-service, paternalism, lack of science, no randomized controlled trials. It was all intuition, right? Well, people very rightly said, you know what, we can science the crap out of this. We can actually do randomized controlled trials. We can build systems, PQRS, MACRA, MIPS, HCAHPS, patient satisfaction, and quantify it all with an electronic cash register. I mean, electronic medical record. And that way we can take a lesson from the business world about how to do medicine, because medicine is a business, right? So the carrots and sticks all apply. And then I see you guys here, so passionate, watching this live case from Israel where you're actually changing somebody's life, connecting with a human being by touching their heart literally, and you're telling me you can reduce it to that? It's enough to put us in therapy, like my friend Doc Vader.
These EHRs are killing me. The other day I tried to put in a new password. These administrators suck and should all die like Jedi scum. And I got a call from IT. You can't do that. It's offensive, and also there are no numbers, capitals, or unusual symbols. And I'm like, is this an unusual symbol? Can you hear this? Can I use that as my password? No? All right, how about this? Sith Lord 66 and make the S a $sign and make the L capital, and we out. F this computer.
Who wants to tell Doc Vader about two-factor authentication? Right? And by the way, people that may or may not be me in a mask, okay? I'm not saying, we've never been seen in the same room, but we don't know. So the question is, in Health 2.0, what have we gained? We've gained a lot of science, we've gained a lot of quality improvement, which is so important. We've gained an ability to read handwriting in the form of electronic medical records. But what have we lost? We're staring at a screen, we're clicking boxes to please a bean counter who's never touched a patient. We've lost the heart of it. We've lost what was beautiful about 1.0. And you know what else we've lost? Winnie the Pooh. Or should I say Mr. Pooh, the 30th patient out of my 40 in my primary care clinic. Let me present him to you real quick. This is an example of how we care for patients now, and then we hand them off to you guys to do stuff to their heart. Here's why. Mr. Pooh presents with an anxious, concerned facial affect concerning for ICD-10 48.10 anxiety with depressive features. I see a black necrotic nose, which forces me to alter it to ICD-10 18.140 cocaine abuse with induced anxiety. He has a protuberant central obesity concerning for early metabolic syndrome with insulin resistance, finding confirmed and supported by the complete absence of fingers and toes on all of the extremities, concerning for diabetic polyneuropathy with auto-amputation. And despite his name, he hasn't. Concerning for diabetic gastropathy with constipation. And despite this litany of glucose-related complaints, Mr. Pooh presents to your clinic with his auto-amputated right paw deep in a jar of honey. Now, I have 25 minutes to see this 99205 level 5 new visit. So I start like this. Mr. Pooh, click, 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 click. What are your allergies and medications? Click, 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 click. And he goes, oh, bother. Aren't they in your computer? And you go, click, 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 click. Yeah, they're in the McKesson unit across the street, but that doesn't talk to our Epic unit here. So why don't you have Christopher Robbins walk across the street to get those records, print them out, and bring them back here in a HIPAA-compliant fashion. Maybe call an owl from Lord Voldemort, and we'll scan them into our paperless system, and we'll have them available in maybe 3 to 6 weeks. So let me ask you again, what are your allergies and medications? And he gives you all the incorrect information. Now I have 5 minutes left to tell Mr. Pooh that he has a new diagnosis of diabetes that may lead him to need intervention from you guys. So I say, Mr. Pooh, the thing is, you're fat. Don't use the F word or he will rip you a new one on Yelp. Mr. Pooh, you are off thin. You should probably diet and exercise. There's a million things you could do, but you know what? I know you're not going to do them. So here's 5 different medications. Here's 6 different specialty referrals. Here's 7 different tests we're going to order. Admit you to the hospital for 8 different days. Amputate that 9th little bit of dangling toe. Number 10, here's a glucometer. Check your sugar 3 times a day. Don't eat crap, and we'll see you in a week. Thanks, bye. And he's continuing to eat, and you're continuing to click, and he walks out. And as he walks out, you see a pop-up in Epic, and you go, hey, yo, Pooh, don't smoke, bro. Smoking cessation canceled 99405 complete. Click. $5 pre-tax. That is Health 2.0. And here's the thing. Is he going to come back and see you in a week? No, but I know where he will be. Bounce, 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 bounce. That's the ER. Look at his foot. He didn't see you. They check his glucometer. It just says OMG. And at this point, his auto-amputated right paw is still in a jar of honey. And so these 2 clinicians look at him and go, hey, Pooh, why are you still eating honey? And he goes, oh, bother. The doctor just looked at the computer the whole time. And I said, there must be something to that. 2 can play at that game. So I used Dr. Google and got a second opinion. And I found this. Dr. Oz, The Good Life magazine. Eat what you love and don't lose weight. I love honey. And at this point, they look at each other, the 2 clinicians, and under their breath, they point at this frequent flyer bounce back and say, hey, you know what? You can't cure stupid. Why would we say something so terrible about Dr. Oz? I mean the patient. Because deep down, these guys are using humor. They're trying to project a defense on their own deep moral injury. They know that there's nothing we can do for Winnie the Pooh because we don't have the tools, the resources, the autonomy to actually get to the root of this, to work with our specialist colleagues together and cohesively. And that causes what the administration will say is burnout. Burnout is like dialysis. You've had chronic disease all these years, hypertension, diabetes, and now you're burned out. But what's the chronic disease? It's moral injury. It's knowing that you can't prevent Mr. Pooh from getting into trouble. And so we use jokes, oh, you can't cure stupid. We blame the patient, we blame administration, but really, deep down, we are hurt. And it's a crisis. Because we know we don't have the time to go, Mr. Pooh, what hole in your life is the honey filling that you're willing to eat it even though it's killing you? What's going on with the 100-acre woods? Christopher Robin is your homie. Where is he? These are the social determinants of health, the zip code. That's so much more important than even your DNA code. What's up with Piglet? Is there abuse? And Mr. Pooh, have you been dipping into Tigger's crystal meth stash? He has no teeth, people. But we wouldn't know because we don't have the incentive or the training or the time to back up and look at where Winnie's coming from. The 100-acre hood, the social determinants of health. I mean, look at Eeyore. TAVRs is not gonna fix that cyanosis. That's like ECMO level. And I don't even know how you get a scar like that, but you would never know because we don't get into the root causes of disease. And then 60% of physicians tell their kids that they wouldn't want them to do it. And we have epidemic rates of suicide. I used to play a game at Stanford when I was a hospitalist there for 10 years. How many of these patients need to be in the hospital if they just had good outpatient preventative care? And the answer was never more than 50%. Half the patients in our hospital did not need to be there. We've gone to war in this country for less than our own healthcare system has done to our people. And it's no one person's fault, it's a system. And so the question is, how do you fix it? It starts with understanding how we behave and how we think as humans and systems. So there's a psychologist named Jonathan Haidt, an economist named Daniel Kahneman, business writers like the Heath brothers, who all use this paradigm of the elephant as the biggest part of our brain. And I highly recommend you read The Happiness Hypothesis by Jonathan Haidt to dig into this more, because I did at the height of my burnout. And this is what I learned. Our minds divided into two systems, right? The elephant is the oldest part. It's automatic, it's unconscious, it's emotional reasoning and intuition. Hopes, dreams, fears, instant and unconscious. If I say the words prior auth, whatever immediate rush of hatred you felt, that's your elephant. It's a mix of genetics and conditioning by training and education. And it helps us get through life. It's an automatic, quick background processor that served us well evolutionarily, and it's ancient. But in the last million years, this little fella popped up. The rider. This is our neocortex riding on top of this big ancient elephant. Thinking, planning, strategizing, moral reasoning, everything we think that makes us human. Deliberative, conscious thinking. And we think that this guy is controlling this big emotional elephant. But if they disagree, who's gonna win? And it turns out the rider gets tired and just listens to the elephant. He's not the president in this little organization. He is the elephant's press secretary. He exists to convince others in our tribes through speech that our intuition and our feelings are correct. And the next time you go on Facebook and you see a political post and you react immediately, that's your elephant. Then your rider spins a reason why. Well, that guy's a... And if you look at Winnie the Pooh, why is Roo not vaccinated? Because Winnie's elephant hates needles, because when he was a kid, he got stuck 6 times at once in a sitting and doesn't remember why, just remembers he hates it. So then sends his rider on a Google search, vaccines bad, question mark. Comes up first hit, Jenny McCarthy. Elephant goes, looks good to me. Next thing you know, rider says vaccines cause autism, confirmation bias, and we're all guilty of it. And this is why we have so much trouble in medicine convincing our patients of what to do, because we scream at the rider, but we're not motivating the elephant. We're not gently directing the rider so they don't spin their wheels. And if you look at healthcare, it parallels this, right? Health 1.0, intuition, paternalism, emotion, connection, it's all elephant. Health 2.0, science the crap out of it, it's all rider. And the two don't meet, they don't interact well. And so the question is, how do we transcend this and get to the next level, which would be health 3.0? We're all in this boat of health 2.0 with one foot on the shore of 1.0, trying to figure out fee for service, fee for value. Do I do stuff 2 people? Do I do stuff 4 people? What's going on? And our crotch is ripping down the center. What's the shore? The shore is health 3.0. And it looks at elephant and rider and says, get along, you two, you're both part of the equation, but there's a third piece, which is the path. It's our technology, it's our incentives, it's our system, our hospitals, it's conferences like this that the elephant and the rider are walking on a path. And if you don't shape that path, they're gonna go off the rails, because the elephant and rider take the path of least resistance. So how do we repersonalize healthcare? Empower connections where everyone on a team is practicing at the top of their license. Become evidence empowered, but never evidence enslaved, always serving the unique patient. It takes time, it takes incentives, it takes technology, it takes teams, and it takes revising everything. And it might look something like a model that we started in Las Vegas. Turntable Health, we said, okay, how do you shape the path? Well, we don't spend enough on prevention. So how about we do that? Make it primary care, team-based, so you have doctors, nurses, social workers, health coaches, pharmacists, a total interdisciplinary team. Pay for it with a flat capitated rate with some savings if you do good for a population of patients, and charge more for primary care. So it was $70 per patient per month. Who's gonna pay for it? Shape the path. An insurance company, Nevada Health Co-op, covered it, put it on the federal exchange. Patients could get it for free with subsidies, never a copay, because the copay stops people from seeing their primary care doctor. It trips up the elephant. And did it work? So the reason I'm showing you this is the elephant loves to feel that things actually work if you want to motivate them. The reason I made that readmission song in the beginning is, as a hospitalist, all I saw were the failure of primary care. And so if you make a song about readmissions, people start to remember, because their elephant feels something, and they remember, you know what, we should probably communicate that discharge better. We probably shouldn't screw up the med rec, all these little things. Well, it's the same with clinics like this, where bright spots work, show the elephants, and they realize change is actually possible. So here's an open community space with an Xbox Connect where people have to get together and move. There's no controller. So you already get people to connect, which reduces that social isolation. Bring the sick people straight to the back so they're not in the community space. Even our exam rooms were different. Look where the EHR is. It's at eye level around a semicircular table, which means you are typing into the chart and the patient is helping you build their record together. It's their data. We're just the stewards of it. Which means you can't write, 23-year-old drug seeker here to manipulate me. It gets real in a hurry, right? You have to be open and transparent with your patients, and it changes everything in creating partnerships with Winnie the Pooh. This is Andrew with the tattoos. He's a health coach. He does the emotional intelligence
The elephant work, motivating, getting into the heart of what's driving his patients. He comes from their community, 30-minute minimum visits, often longer. Then he texts the doctor. The doctor comes in, does that high-level stuff only doctors can do, and then goes out. And this team effort to actually develop relationships turns the visit from a transaction into a relationship. And it changes everything because you're motivating the elephant. Teaching kitchen, teach Winnie the Pooh how to cook in a food desert on a budget. The rider loves specifics. You tell a patient, eat better. They don't know what you're talking about, and what manifests as resistance is actually confusion. If you tell them, hey, go to Trader Joe's, shop in the periphery where food is fresh, and here's how to cook something every night that's cheap and delicious and healthy, that's different. And the elephant's motivated because it smells hella good, bro. This is another secret sauce. This is Nina. She's our licensed clinical social worker. So she does the, behavioral health stuff, which is 80% of primary care. The supertentorial stuff that we've been dropping the ball on. We don't have the time. We just medicate everybody. Turns out she also teaches yoga and meditation. Now here's the thing about meditation. Administrations will sell this stuff to you. Well, you should be more mindful and use some essential oils and get a massage, and that will help the burnouts. No. What meditation is really good for is looking at your elephant. How do you know what something is unconscious is doing unless you pay attention to your feelings as they arise? And instead of knee-jerk responding, you actually become response-able. You can actually take a step back and go, ooh, that's anger. I could write a terrible email and scream at people right now, or I could take a step and see where that's coming from and act more responsibly. Recognize what the elephant's doing, grow the rider, and it absolutely works. It absolutely works. Patients connect, they lose the social isolation, they learn to look at their elephants and see how they think and how they behave, and change starts to happen. Does it work? In a year, 50% admission reduction. Because again, relationships, they're calling us, they're connecting with us. There's an area under the curve where we know them. And we partner with what we call our Good Guys Network. So those specialists that get it, that want a really good quarterback, you can do the taverns, but then who's gonna pick up after that and really make sure that patient doesn't get into trouble and all the other stuff and the lifestyle stuff that needs to happen after a 3-vessel cabbage or something. You need that partnership, and it works. And the patients are happy. So we use Net Promoter. How likely are you to recommend clinic to family and friends? Dude, 90% is unheard of in healthcare. Now this is all rider stuff. The rider Googled these numbers. I asked my elephant, I need another data point because the graph is unsymmetric. Just something that, you think is right. And he goes, bro, I got you. No evidence for this, but it just feels right. And so the question is, here you have a model of Health 3.0, repersonalized, rehumanized healthcare, where we had to build our own EHR that was about taking care of patients as opposed to taking care of billing, because we didn't bill that way. The path is shaped, the elephant is motivated, the rider is directed. Our providers were so happy they were making a difference. Our patients were being transformed, our specialists loved working with us, and we had bags of medications that we had taken patients off. That was our wall of happiness in our huddle space where we all gathered every day to talk about who was coming in and who wasn't coming in. And this is what our clinic looks like today. And that's all I have. Thank you very much. I'm kidding. That would suck. You seriously thought I was done. Right. I mean, probably should be done after I failed. So this clinic had to close after being open for like 3 years. Why? Because the bigger path wasn't shaped. The insurance company we partnered with that brought us 4,000 patients, changed their lives, went out of business overnight, like a lot of the co-ops. We went to the other insurance companies and they told us, yeah, we'll give you 20 per patient per month for primary care. Breaks the whole model. Oh, and you have to charge a copay. Go to hell, we're not gonna do it. We're gonna close. And then I realized something. As I was super depressed, we found places for our patients that weren't as good. Our specialists were disappointed. It was a disaster. This was in Las Vegas. I looked at the collective elephant, which we all have. In healthcare, do you guys know there's a story in the circus? How do you train a baby elephant? You put a chain around its neck and you stake it to the ground and it tries to escape and it can't. And then it gets bigger, you use a bigger chain and a bigger stake, it tries to escape and it can't. And then one day it's an adult elephant and it's learned all you do is put a little piece of rope on its neck and it sits down. Because an elephant never forgets. Think about medical school. The first 2 years, we're taught to just listen to a sage on the stage telling us all these facts, 50% of which will be proven wrong, and they don't have the courtesy to tell us which 50%. Then the second 2 years, it's about fealty to authority in a guild apprenticeship, where the goal is kiss the ring of the attending physician so that one day you will be the ring that's kissed. This is a perfect recipe for innovative out-of-the-box thinking, for risk-taking, for systems transformation. It's a recipe for a herd of elephants that are the smartest, most creative people in the world who work through their moral injury and their stress by working harder. We work harder thinking that's going to make it better. And every time we do that, our elephant just sits down. This system is the system we have to adapt to, and we adapt and we adapt and we adapt, and then we break. And we blame ourselves. What if we stood up as a herd of elephants and we rallied and said, no, actually, we know how to fix this. We know, we've seen what Health 3.0 can look like in our specialty, in our town, in our local hospital, and we can do it, but we're scared. We need support. We need a we. And you know what? It's interesting. So in between destroying democracy and forcing me to friend several Russian bots that are still close friends of mine, shout out Dmitry, Facebook did something remarkable. They democratized live video. The whole time I was building Turntable Health, I was growing a social media video outlet, and it turns out there's 2 million healthcare professionals who are part of Doc Vader, Zdogg MD across platforms. That is a herd of elephants, you guys. They call themselves the Z-Pack. Because they're trying to get me sued by Pfizer. But these guys all share a common goal, which is the emergence in a team-based way of Health 3.0. Imagine if we teamed up with nurses, how much damage we could do, instead of being in our silo. And that's what we're trying to do. With live video, I can do a show with someone really smart, bring that model to hundreds of thousands of people per episode, show the bright spot. The elephant can leave emojis showing their emotions, and the writer can write comments showing what they think. And then they can hit share and rally the herd. And I bet together we could catalyze the emergence of something way better. And you guys have to be a part of it. We need you. We need smart, amazing people to lead this revolution that we're calling Health 3.0. And so the other day, my dad actually called me. And he's like, so you're unemployed? I said, no, Dad, let me explain Health 3.0. I teach at our county hospital. I round for free so that I have no financial conflicts. I can say anything I want. I want to be the unfiltered voice for everyone here. We're going to emerge this. And he goes, so you're saying you're unemployed? Well, I'm going to tell you something, Zubin. You have always been the oldest child. Scratch that. You are the only child. Because the other two didn't go into medicine and they're dead to me. As the only child, you've always been the best at complaining, at whining, at playing the victim. Well, now is your chance to stand up and show everybody together that you can build this Health 3.0. And when you fail, which you will again, you can come crawling back to me and I will give you nothing. And I started getting teary because that was the most positive my father has ever been about anything I've ever done. And so I want to leave you by telling you, look at your elephant, look at your rider, look at the path. Are you living your story to connect with purpose? Because that's what the meaning of life is. It's the meaning within life, the connections between us. Are you doing your part? And if you aren't, you need to change the path, change the story your rider's telling, and join this movement. And I'm going to leave you with a little ditty that I hope does just that.
Look, if you had one shot, one opportunity to unbreak healthcare in this moment, would you capture it or just let it slip? Yo, her palms are sweaty, gloves tight, arms unsteady. There's vomit on her scrubs already, from four spaghetti. She's nervous, so the nurses they look on with pity. She won't stop. Student loaded 4 ain't pretty, so she clicks on her inbox. Grows so loud, she opens the jar, but the